Hey everyone, this is our presentation for COPD, also known as chronic obstructive pulmonary disorder. It's a treatable but irreversible lifelong chronic disease that affects the lungs and the airway. It causes a reduced airflow and an obstruction and difficulty breathing, and it is commonly known as having periods of remission as well as exacerbations. And we'll see that there are two main types of COPD, chronic bronchitis and emphysema. So, next slide, please. Um, this is the first type of COPD, which is chronic bronchitis. On the left, you see a normal bronchial tube, the main airway. Um, It's dilated. It has a nice wide opening for air to enter and to leave. And on the right side, we see a bronchiole that is in a patient with chronic bronchitis. It's inflamed, it's constricted, and it also has an increased mucus production, which further decreases airflow patency through it. And if we go to the next slide, we see the signs and symptoms of chronic bronchitis. And people with chronic bronchitis sometimes are called blue bloaters for short. It's due to the hypoxia that causes a blue tinge of the skin. Um, and more of the telltale signs of chronic bronchitis include a cough that comes up producing mucus, and that's because of the increased mucus production that we see. Also, if you listen to the lungs, you can hear a rattling sound. And that's also due to the increased mucus production. They will also have a faster rate of breathing and a more troubled time with breathing.
So the next type of COPD that we go over is emphysema. Emphysema is a condition in which the air sacs of the lungs become damaged and enlarged. This then causes hyperinflation of the airway and also leads to a destruction of the alveolar walls. On the image, you can see a normal bronchiole. The alveolar walls are still intact and gas exchange is good. And on the right shows emphysema, where the walls sort of become damaged and gas exchange isn't able to do what it needs to do. So going over to the signs and symptoms,
What?
these people are tend to be called the pink puffers. Some of the signs and symptoms that they're going to have is accessory muscle use. This is due to the gas exchange. They're not able to get oxygen to the blood, so that they're trying to use their accessory muscles to push the oxygen into the alveolar so that it does get to the bloodstream. They're also going to have a labored breathing, so you're going to hear them as they breathe. They're going to have some noise. They're going to also have a barrel chest. This is going to due to the hyperinflation of the lungs and the entrapment of air, going to cause their chest to swell up. Also going to cause the labored breathing because it's going to be difficult because you have that pushing that pressure in the thoracic cavity. And they're also going to have a thin physique. This is going to be due to their decreased appetite and fatigue due to the increased work of breathing and their anxiety. Next slide.
So here we see an example of tripod positioning. This is a posture that's seen in patients that have chronic bronchitis and emphysema. The patient is leaning forward and bracing their arms on their knees or could be on a nearby surface. This is a compensatory position because it optimizes the diaphragm's movement and makes it easier for them to recruit accessory muscles. So basically, they're stabilizing the upper body and it helps the patient use their neck and chest muscles to expand the lungs versus using their diaphragm. So in the clinical setting, when we see that in the patient, it's usually a sign that they're experiencing significant shortness of breath and they're trying to maximize their breathing efficiency. Next slide.
So right here we have the treatment for COPDs, and the goal of the treatment would be reduce the signs and symptoms and prevent future complications. And the first one I can see right here is the stop smoking for the patient who is a smoker. This would be the best option for them. And secondly, we have right here we have the environmental irritations. So for the people who's always working in the dust or exposure to the chemicals, the best for them is either stay away from all these irritants or they can wear protective equipment such as a mask or gloves. And we also have the supplemental oxygen. And this would be depends on the physician and the progress of the COPDs of the patient. And one thing to keep in mind for this oxygen, it has to be exactly as doctor prescribed so that you can be orate or it can be used less of it. And there's you shouldn't have any fires around it or it's gonna cause explosions. And next slide. And right here we have the medications. So the bronchodilators, this is the common medication we use. We can use as a short-term or long-term. One of the common ones would be albuterol. This is going to help you to open up your airway so you can breathe better. And we also have the corticosteroids, and these are the medications you can use as a combination of the bronchodilators, but for corticosteroids, you cannot use for long term. So just keep in mind, try to use them short times. And also we have the antibiotics, and these are for the if you have the information, if you have the infections occur, and the antibiotics gonna help you to counteract the bacterial infections of it. Next slide.
So on this slide, you can see some of the breathing techniques that are used to help patients with COPD and helps manage the symptoms. The first one is pursed breathing. This is where the patient breathes in through the nose and exhales slowly through the lips that are pursed, kind of like almost like whistling. And this creates back pressure in the airways, and that allows for a more complete expiration and improves ventilation. The next one is diaphragmatic breathing, also known as belly breathing. This is a technique that focuses on engaging the diaphragm instead of the accessory muscles. And you place a hand on the abdomen and practice slow, deep breaths. And this helps improve ventilation efficiency and it decreases the work of breathing. And the last one, as you can see in the photo, is an incentive spirometer. This is a device that encourages patients to take slow, deep breaths and helps expand the lungs and improve oxygenation. Next slide.
Okay, some of the big risk factors or causes of COPD, the biggest being smoking and secondhand smoking. With that, also, if you live with somebody who smokes and you're around that, you also have a higher chance of getting COPD. The other ones are workplace hazards, just chemicals, dust, working construction. Good example around here in the valley, if you are working in the almond orchards during harvest, breathing all that dust in over time can cause COPD. Might cause that because the smoking causes it because the smoke and chemicals in the cigarette smoke cause irritation in the airways, which causes chronic inflammation over time, and that can cause the airway to thicken and harden and become scarred, and so therefore they don't perform gas exchange as well. Another one is air pollution. If you live in an area with high air pollution and you live in it for a long time, over time that can cause COPD also. And one of the more rare causes is a genetic deficiency. Basically, your liver doesn't produce alpha-1 antitrypsin, which allows an enzyme called neutrophil elastase to attack your lung, whereas normally the antitrypsin would protect your lungs against the enzyme. And then also a history, if as a child you had a lot of chronic like lung infections over time, that can cause scarring and also lead to COPD in the future. Next slide. And some resources we found were the COPD Foundation, which provides information and resources on how to manage COPD and live with it. Another good resource is the American Lung Association, which offers support groups. One of the big ones is called Better Breathers Club, and they also offer free smoking cessation programs. The next slide. That's going to be our resource where we got the information. That concludes our presentation. Thank you.